It's Chris here. I was thinking about all those years that I spent working in a rural hospital and how hard we worked to sign people up for Medicaid. Many of these people are not employed, they're drug addicts, mental illness, other things. In fact, society might say that they were able bodied. Why did we work so hard to do that? Well, the federal law is that if somebody comes to a hospital emergency room needing treatment, then treatment needs to be provided until the patient is stable. That results in tremendous cost to the hospital staff, diagnostics, the equipment, procedures, all those kinds of things, right? So, hospitals with these uninsured people were undergoing these costs and they had no ability to pay. So hospitals were eating the cost. And in rural hospitals where the margins are so thin, where they're often running deficits trying to stay afloat, these loss from these uninsured people coming for treatment and using basically the ER as their primary care, hospitals began to realize that if we could get these people signed up for Medicaid, then Medicaid would start paying the cost, reimbursing the hospital for the treatment provided. Now, of course, Medicaid reimbursement is nowhere near what it actually costs the hospital, but it helps minimize the losses. And with Medicaid, you saw a resurgence or a surge of urgent care clinics in these small towns because now there was a financial incentive to open an urgent care clinic that could bill Medicaid for primary care treatment. So the burden was shifting away from the hospitals to these urgent care clinics who were had these people that were using the Medicaid that the hospitals got these people signed up for. So now we're going to take Medicaid away from all these people, and we're going to tell them work requirement. It's kind of tough for an addict or somebody with mental illness or other disability to really get and keep a job. So basically, these people are going to be uninsured again, coming to the hospital, and these hospitals are going to have to start eating the cost, and their financial situation is worse than it ever was. So you're going to see a lot of rural hospitals close because Medicaid is going to be harder to get.